Kate and welcome to Adulting 101. Today we're going to talk about how to sign up for health insurance, in particular about special enrollment periods. Did you know that if you need to buy health insurance on your own, there's only a short window every year where you can do so, known as open enrollment. Open enrollment usually is at the end of the year, starting November 1st and ending December 15th in most states. Which means if you miss your chance to sign up for a health plan during open enrollment, you could be out of luck for an entire year. But there's good news. If you experience a big life change, you could qualify for what's known as a special enrollment period, or an opportunity to sign up for coverage outside of open enrollment. In more good news, young adults are more likely to experience one of these life-changing events than older adults. So if you're a young person who's uninsured and looking for coverage, there's a good chance that you could get covered without waiting until next year. Now let's dive into which life-changing events will qualify you for a special enrollment period. Qualifying events generally fall into two categories: those that result in a loss of health coverage and those that cause a change in household size. A loss of coverage could be turning 26 and aging off of your parents' plan, graduating from college and losing your student health insurance, leaving a job and losing employer coverage, losing eligibility and coverage through Medicaid or CHIP, a permanent move that results in a loss of coverage, or any other loss of comprehensive health coverage. The second category, a change in household size, can qualify you for a special enrollment period thanks to a change in your household. And by household here, we don't mean your roommates. We mean the way the IRS would mean household. So your dependents and anyone you file taxes with. So these changes could be getting married, having a baby, or adopting a child or another dependent. And there's one important caveat here to the second category. One member of your household must have existing coverage in order to qualify for a special enrollment period. So for example, if two young adults get married, at least one of the newlyweds must have previously had coverage in order to qualify for a special enrollment period for the other newlywed. As we said earlier, young people tend to qualify for special enrollment periods more than anyone else. Things like getting married and having a baby tend to happen in young adulthood, and 100% of people who turn 26 are young adults. So those are the most common ways that young people qualify for a special enrollment period. But there are some less common ways as well. So if you need health coverage now, go to healthcare.gov to see if you can qualify for a plan. You may need documents to verify that you qualify for a special enrollment period, so make sure you save any letters or documents that can prove your loss of coverage or your change in household size. And then don't waste time. Your special enrollment period will only last for 60 days after a qualifying event. But in some cases, you can also sign up in the 60 days before the event as well to make sure you don't experience a gap in coverage. And finally, depending on the state you live in and your income, you might qualify for Medicaid, and Medicaid enrollment is open year-round. So there's nothing to lose. If you don't have health insurance, go to healthcare.gov and see what you might qualify for right now. Still have questions? Shoot us an email at digital@younginvincibles.org or drop a comment below. And don't forget to subscribe to our channel so that you never miss a new episode. Till next time.